Hello, everybody, and welcome once again to Functional Medicine with me, Dr. Howard Robbins. Our show is dedicated, as you know, if you've listened or if you haven't, to safe, healthy, and effective ways of eliminating medical problems and conditions that you wouldn't believe are possible. And I've been doing this now. Well, let me tell you about that when I get into the show. I have to thank our sponsors because our sponsors are very important in keeping this show up. And please subscribe to our channel. That certainly helps. Our first sponsor is Promolife. Promolife.com. They make medical ozone generators for home care for doctors. They have a whole amazing line of ozonated products that you can be buying and taking orally. You go to their website, promolife.com, but when you're ready to order, call them at 888 742 3404. 888 742 3404. Tell them you heard about their products here on my show, and they'll give you a percentage off or they'll do something special for you for certain. Also, I want to thank my sponsor, Doctors Biome, DoctorsBiome.com. Sounds like doctorsbiome.com. They make a very special, very important to what I talk about and do with ozone, a probiotic beverage. Actually, it's important to just about everybody because it's essential to have a healthy gut. The gut connects to everything. Look it up. The gut organ axis. The gut connects to everything. And if you've had antibiotics even once in your lifetime, or you eat red meat or chicken that isn't organic, kosher, halal, or farm raised fish, you'll get uncooked out. I don't care if you burn the meat, uncooked out doses of antibiotics, killing all the good boys off almost instantly. Doctor's Biome is a very special 15 patented proprietary strains of living bacteria. They're living in this one delicious 100% organic juice. So they're growing in number every day. They're next generation bacteria, so they're created to survive the stomach over 90%, whereas capsule, powder, and tablet probiotics are destroyed over 90% in the stomach. And then hopefully they come back to life out of suspended animation. Well, guess what? They don't. So these are already living. And because they're living, they're able to go to work and replenish the healthy bacteria in your gut, killing bad bacteria in your stomach and in your small intestine and in your large intestine along the way, getting yeast in balance again and replenishing the good boys in the wall of your gut. This is why it's so important. And you're welcome to use my coupon code that I have for my patients, because while it does come with a 100% money back guarantee and free shipping, using my coupon code will get you 10% off the retail price. I promise it's worth every penny. You won't be sorry if you buy it and take it. Doctorsbiome.com. And if you want to save another 20%, as I tell everybody, go on auto ship, or which I think they call subscribe and save. Now you'll get 20 total percent off with my coupon code in that, and that makes it even more affordable for people. You won't be sorry. I can promise you won't be sorry. Now let's get right into the show, and this show is entitled Major Autohemotherapy, MAH versus, that's Major Autohemotherapy, which is a form of intravenous ozone therapy, versus Direct IV Ozone Therapy. There's been controversy for years about it. So let's get rid of this I'm going to hopefully get rid of this controversy on this show once and for all. Because patients are calling me up. They've read things on the internet. They've read about it on various that are when they look up ozone therapy, and it's confusing. Keep in mind that AI go through the internet and pick up whatever they have read, they have gleaned off the internet. So they often can give you misinformation. Now, let's start with this. I have been doing intravenous ozone therapy since 1990. For the last, as the date of this show, April of 2026, I've been doing it for over 35 years. I've done over 430,000, we're getting close to 435,000 intravenous ozone therapies. When I began, Dr. Robert Atkins, my mentor, the diet doctor who got me started with this, when we began in January of 1990, I only knew what I was told to do. In major autohemotherapy, it's like giving blood to the blood bank. You take out a certain amount of blood, giving blood to the blood bank, and it comes out slowly. The collection container is usually on the ground. And when I learned to do it, I learned to do it in the classic way using glass collection bottles. Today, they're using an unproven safety method, an unproven method for safety, where they take it and they collect it into a plastic bag. It's a special plastic, but it's a plastic bag. Just like blood is collected at a blood bank now. They don't use glass containers. Glass can more easily break. So they use these plastic collection containers for the blood, which is safe for the blood, but not necessarily, and we're going to talk about it, safe with ozone. Now you take the bag and you hang it up, and you let the blood, you add oxygen and ozone gas through a special port, we call it, in the bag. And I used to use ports in the glass collection bottle, the rubber stoppers, if you wish to call it that. And then by pushing the gas in there, you mix it by shaking it gently, and then you let the blood drip back into the body, adding more oxygen as the blood slowly empties from the container to keep the pressure in the container up to help in the pushing of the blood back into your body quicker. It's very beneficial. I did it 45,000 plus treatments because I was seeing over 100 new patients a month. And everybody had to get the therapy at least 3 times a week. So we started to see, when we began using it in 1990 through the end of 1994, we started to see what benefits it had. And man, it was amazing. It helped everything get better quicker, but it wasn't getting rid of any medical problems. We're also doing intravenous vitamin C back in those days, up to 200,000 milligram intravenous vitamin drips. And in addition to doing this particular ozone method. So we were seeing benefits and helping people get over problems. And what we found out, it was the vitamin C at high doses. Most of them were 100,000 milligram vitamin C drips that was killing off virus, fungus, yeast, mold, bacteria, parasites, toxins, and removing them from the body. Well, we learned that Direct IV Ozone can do all that and better. So anyway, so for all these 5 years, we were doing thousands upon thousands upon thousands of these treatments. And of course, we had some problems sometimes. A vein would close down. We would have to find another vein to get the blood to go back in. Thank God, in almost all the cases, we were able to get the blood to go back in. Once in a while, we had a problem. It always seemed to happen with patients who had AIDS and other problems. Of course, you could only do the therapy on people with big veins. That's one of its limitations. Only 3 or 4 out of every 10 patients, and I'm being kind when I say 4, 3 or 4 out of every 10 patients could have this therapy done because their veins were small, too small for a blood needle. And if you used needles that were too small, it would destroy the red blood cells. You can't destroy that many red blood cells. It's just not done. So you'd need a blood needle. You'd need 18 to 20 gauge needle to be able to do this in an effective way. And we were using 300 cc's of blood, the way I was taught. That's the way it was classically used around the world when the safety studies were done using this method by Jacobs back in Germany in 1983. And it was using glass collection bottles as well. There is no safety study showing that it is safe to use these plastic containers because ozone will react with the plastic in the container. And microplastics are a very serious problem to me, as well as they should be to anyone listening to this show. So there's another problem with it. Next, It destroys what's ever in that blood, but it doesn't really put any significant amount of ozone back in your body. Why it works is because probably in some of the blood, the reason I say prominently, I presume that's why it works, there's some glutathione. Glutathione is a protein your body makes, so there has to be some in the blood. And some of the ozone dissolves instantly in the blood, but it can meet glutathione in the blood and stimulate other immune products to be created when it gets back into your body. And that procedure used to take about an hour, 45 minutes to an hour, about a half hour to extract that much blood, and about another half hour to put it back in. Today, they're using 200s or 150 or 100 cc's of blood. It's still called major autohemotherapy. Actually, anything, I believe, in the ozone world over 50 cc's of blood, 50 cc's of blood or more is considered MAH. But they're using smaller doses, so you're getting smaller amounts of medicine. Now, it is my opinion that though there's controversy on this, that some of the ozone attaches onto the empty iron molecules on the red blood cells. Now, keep in mind, every red blood cell should have 4 iron molecules, and each iron molecule is supposed to hold 4 oxygen molecules. That's 16 oxygen molecules per red blood cell. But in venous blood, some of the oxygen has been given up. So ozone, I believe, O3s can attach onto those iron molecules and that's why some of it gets back in also with major autohemotherapy. And that's why I believe some of it does. We get some good from MAH. I learned something that Dr. Velio Bacci, one of the big names in ozone, knew. MAH helps everything, but it gets rid of nothing, meaning it helps most medical problems that ozone can help, almost every medical problem, but minimally. My patients don't come to me to get better. They come to me to get rid of their problems permanently, completely, once and for all. We were working with a doctor that was doing MAH to treat only AIDS patients, and they were improving as we saw them improving when we did MAH. But when we turned to DIV, and that's what I'm going to talk about in a few minutes, we got rid of HIV. Simple as that. Now, let's get back. So, MAH limitations. You can only do a certain amount of blood. You have to have big veins. It's time consuming. Today, they're using small amounts rather than larger amounts. So you're getting less for your money. You need big veins for it. They're using these plastic collection bags that unfortunately may be causing damage on their own, possibly with microplastics coming off from the ozone that when you inject it into the blood that you're getting back into your body. I don't care if you put that blood through ultraviolet blood irradiation machines, which you can do, which does add benefits, by the way, to an MA therapy. That I'm willing to admit it can add value on. And often they charge more for that. So that method is predominantly used here in the USA and in Western Europe and in some Eastern European countries. And it seems to be a method they enjoy using. It wasn't developed until 1961, I believe, by Wolf, and it didn't become the way to do it in Europe till 1980-ish, when other methods of ozone were changed in Germany, banned in Germany for various reasons. There have been only, we'll finish up with this, 4 known deaths published in medical literature, all from major autohemotherapy, 2 here in the USA and 2 in Europe. If you go to the FDA website, there's a section called MAUDE, MAUD, is the way I pronounce it, Adverse Event Reporting Site. And they have death back in 2007, death from an MAH therapy. There is nothing recorded on an FDA website about death from a DIV therapy. In fact, worldwide, there is no deaths that are recorded in the medical literature from direct intravenous ozone therapy. No recorded deaths from direct intravenous ozone therapy when performed by a medically trained ozone doctor using medical ozone machines and supplies. Only laymen using the direct IV method have ever hurt themselves. And we have seen that. Killing people. One person we know was killed because her daughter treated her, who was trained by these naturopaths using some crazy ozone machine and on. So virtually no deaths. No matter what they tell you, no matter what you read on the internet, there are none. It's been proven. And I can contest this with anybody and win. Now, let's go into DIV. First of all, it was the first intravenous method of ozone therapy ever used worldwide. It goes way back in, let's call it the modern ozone era, to post-World War II. So that's the major method that was used to treat all the burn victims and all the wounds and everything in Europe when they had no money, no pharmaceuticals to treat these things. So worldwide, it's the least expensive way to do it. Obviously, not everybody can afford the materials that are involved in MAH. Certainly with direct IV ozone, all you need is a syringe and a butterfly needle, butterfly set. Today we have very small butterflies, 27 gauge butterflies, so we can get little itty bitty veins. 10 out of 10 patients can be treated with DIV. In addition, you can use what's called a PICC line. In a PICC line, it's a surgical procedure. They put a line, a plastic special tubing that goes to your heart that seems to be ozone for the most part, as we've been able to figure out. And with the PICC line, you can use direct intravenous ozone. You cannot do MAH PICC line because it can cause clots that can cause you a stroke or a heart attack and kill you. But with direct IV, there's a technique that we teach doctors so you can push the gas through a PICC line. So 10 out of 10 patients can be treated with direct IV. Since there's no extra plastic containers or anything, we don't have to worry about extra materials. It's very easy to perform. It takes only 2 to 6 minutes, so it's faster. Because there's no materials and time involved with paying for nursing staff, getting rid of medical waste is minimal, you can charge much less money and make it more affordable for people. I know most of the doctors that I've trained charge 2, 3 to 4 times more than what I charge, but worldwide, please excuse me, my eye itches. Worldwide, DIV is probably the oldest and most commonly used method. Okay, its speed, its safety, and its effectiveness, and the fact that it's very low cost. With MAH, you don't really know how much ozone you're getting in the body. With direct IV, it's really simple. Based on if you're using a quality machine that's giving you an accurate dosage, the amount of gas times the concentration in micrograms that you're using of the ozone coming out of the machine multiplied gives you how many micrograms of ozone you got into your body. When it goes directly into your veins, it directly goes and destroys every virus, fungus, yeast, mold, bacteria, parasite, toxin, and harmful free radical. But in addition, this method can actually chelate toxic metals off nerve tissue where all the damage is done by toxic metals, as well as melt calcified plaques. And if you want to listen to the show I'm going to be doing soon on chelation therapy, it'll explain all of that. And regular chelation therapy cannot take the toxic metals off nerve tissue, which includes brain tissue, not just peripheral nerves and spine and the spine. Direct IV has been shown to get rid of viruses. MAH, minimal benefit at destroying viruses. When we went to Sierra Leone in 2014, on the invitation of the president of Sierra Leone, to train doctors in it, we were published in the African Journal of Infectious Disease, showing that Direct intravenous ozone therapy would be worked on curing 5 doctors from Ebola, which has a 60% death rate. When you do 5 out of 5, that's a grand slam home run. You just won the World Series, the Super Bowl, and the Stanley Cup all in one fell swoop. Okay. World Cup in soccer, all in one fell swoop. That's amazing. So we proved that direct IV ozone can work against viruses, which it's been shown to do against the polio virus and other viruses that I can't name or they'll take this whole down. It begins with the letter C that was once was a pandemic worldwide recently. And we've had amazing success fixing that as well with direct IV ozone therapy. Again, using little itty bitty needles, we can get 10 out of 10 patients. It works on virtually every disease and condition. We're able to treat. It takes a 2 to 6 minute treatment. Even just 3 or 4 doses a week is enough to help most everybody with most every medical problem. Just does. More can be better in most people for most things. It'll speed things up. In addition, you can combine it. Now, one of the reasons it works is when the gas goes directly into your body and it does all those things, it also meets that intravenous well, not intravenous, but it meets glutathione, that protein your body makes. And this releases, according to Dr. Bacci, and I got a big round of applause even from the people who don't like me in the ozone world, showing that meets this glutathione. You release all these reactive oxygen species, alkenes, alkanes, peroxides, peroxyls, superoanions, and lipid oxidation products are created. Alpha and beta interferon, interleukins number 2, 6, 7, and 8, and tumor necrosis factor, another all these things fight the battles that you need fought for all your diseases. And direct IV ozone makes all this happen in large amounts, and then you can combine it with intravenous glutathione because oral glutathione is completely destroyed in the stomach. But intravenous glutathione in what I call a Robbins glute sandwich, half your ozone, then the glute, then the other half of your ozone. So we sandwich it together and we create an even more powerful kill-off reaction for all these things that we don't want in our body without harming people. I've done this 385,000 treatments over the past 30 of my 35 years. We're in year 31 of Direct IV, showing not only its benefits, but its safety. There is no way I could have done this given over 385,000 treatments to thousands upon thousands of people and not hurt somebody at this point in time. Yeah, like-it veins don't like anything going in them, but at least we're able to use little itty bitty needles and we have ways of overcoming issues like that as well. All right. I can go on and on about this, but I don't like to make these podcasts so long. If you haven't been made clear why direct IV ozone, and particularly Robbins' method, is superior to MAH, do what you like, okay? You may be living in an area where only MAH is available. Well, get your doctor to come and get the training with me. I have patients every year that work deals out with the doctor that I've learned you can do. Pay for their training. It's not inexpensive. Pay for their training. And when they come back, they have to treat you until you're well with the direct IV method. If they're open-minded individuals, it's worth the 3 days of training that it takes me to teach them everything they need to know about ozone and direct IV therapy to do it safely and effectively. Okay, to learn all the gems and pearls that I've gleaned over the past 30 doing it and over 385,000 treatments. So I want to thank Promolife because you make ozone generators that can be used for these therapies. Promolife.com. They make wonderful ozonated products. Call them at 888-742-3404. I want to thank Doctors Biome because every one of my patients that do DIV, and for those of you that do ME, taking Doctors Biome, Go to doctorsbiome.com, use my coupon code Howard35. Also, if you have questions about this or want to get started, you can call my office in Manhattan at 212-581-0101. That's 212-581-0101. Thank you, everyone. Please subscribe to our channel. Tell everybody about this. I hope this show, by popular demand, was done so that you now know the difference between MAH and DIV. Bye now.